Hi, today is going to be a bit longer video because I want to talk about a little bit what happened last Sunday. Yeah, I was catching up with two friends of mine, and one of them is working, say, 6 days a week, and she told me about how for the last few weeks she has been having headaches and fever and sore throat. So I asked her, so did you see the GP? And she was like, yeah, I saw the GP twice, but the GP didn't really diagnose me with anything or give me anything. Just told me to rest, but I can't rest. Um, and I have to work. And I wasn't sure how to respond then, because what I want to say is kind of can take some time to explain. And so I've decided to talk about health in this video. I'll give a little bit of a background. It was after I went to church, and it was after church service, and they are my life group leaders, like church group leaders, and we were just chatting. I I think there is this idea that we could go to the doctor, and the GP would give us this pill that will just like quick fix, makes the problem go away. And I want to reference another YouTube videos that I watched a few months back. The video is about a MIT educated neurosurgeon who I think quit and stopped practicing medicine. So basically, I want to talk about his story a little bit. So he says something to the effects of, so he studied medicine in the US for about 10 years and became a neurosurgeon when he was about 30 years old. And he practiced surgery for about 10 years and quit this year. What happened to him was he has many patients who come to him for back surgery. And even though, to a long story short, even though he did the perfect surgery, like some patients will get better and some patients will stay the same, and other patients will get worse, like even though they did the exact same surgery. So then he started to really wonder, what makes the body heals, what it takes to get better, whether it's fever or sore throat or back problems. So he started, every single patients that he started asking all the questions that he could think of, like are you eating well, are you sleeping well, like, are you under a lot of stress, do you do illicit drugs, like do you regular exercise regularly, do you have many friends? And what he discovered, like, is his anecdotal evidence, like from his personal experience. It's not like a scientific research or study or anything. It's just his personal experience as a surgeon for 10 years. Is that people that get better, that heal, like even without surgery, are those who, you may probably have guessed, are those who eat a healthy and balanced diet. They sleep well. They are not under a lot of stress, or if they are stressed out, they find ways to release the stress back into the universe somehow. They have a good social support group, many friends, and yes, stuff of that nature. And conversely, if the patient like smoke like a chimney, like just sit at home all days and don't have a job, like don't have meaningful work, they're not eating well, they're not sleeping well, they're under a lot of stress, and yeah, those even he could do like a perfect surgery on them. The patient could get better temporarily, maybe for 3 months, 6 months, but then the patient has to come back because of the same problem or different problem. So for I guess at least for me, uh, part of the moral of the story is that what it takes for the body to heal, to get better, is like a combination of diet and sleep and connections and exercise and all of that. And if we do all of that and we have a really good shot at leading a healthy lifestyle, but if we are stressed out all the time and we couldn't sleep well, uh, there is limited what we can do to there's limited what the doctors can do to help your body heal and to get better.